Good evening. Let's call to order the Champaign County Board, Tuesday, March 27th, 2018. The time is 6:31. Roll call, please.
Clifford. Coert. Cruz. Esri.
Here.
Furtado. Goss.
Present.
Harper.
Here.
Hartke.
Here.
King. Marsh.
Here.
McGuire. Mitchell. Patterson.
Here.
Petrie.
Present.
Rector. Rosales.
Here.
Storr. Summers. Tinsley.
Present.
Anderson. Clemens. Weibel.
Here, we have a quorum. Today's prayer, inspired by Lori Busboom, but I'm thinking of Stan Harper. It's the springtime prayer, Ralph Waldo Emerson. For flowers that bloom about our feet, for tender grass, so fresh, so sweet, for song of bird and hum of bee, for all things fair we hear or see. Father in heaven, we thank thee. For blue of stream and blue of sky, for pleasant shade of branches high, for fragrant air and cooling breeze, for beauty of the blooming trees. Father in heaven, we thank thee. Pledge of Allegiance. Would the clerk please read the notice of the meeting?
Notice is hereby given that a regular meeting of the County Board, Champaign County, Illinois, will convene on March 27th, 2018 at 6:30 p.m. in the Wild Shields Meeting Room, Brookins Administrative Center, 1776 East Washington Street, Urbana, Illinois, in said county for the purpose of allowing and ordering the payments of claims against the county, receiving and acting upon reports of committees and such other matters as may be brought before said meeting, which said meeting shall continue in session from day to day until the completion of said business.
Thank you. Seek approval of the agenda and any addenda. Moved by Mr. Mitchell, second by Mr. Rosales. I want to point out that obviously item 16B, there will be no action on that. That's the Rosecrans lease. Any other discussion on the agenda? See none, all in favor? Aye. All opposed, motion carries. Date and times of our next regular meetings. Facilities meets on Tuesday, April 3rd, very early this month at 6:30. ELUC at April 5th, 6:30. Highway and Transportation at April 6th at 9 o'clock. I point out the ELUC meets on Thursday, April 5th. And the Committee of the Whole for Justice, Social Services, Policy, Personnel, Appointments, and Finance meets on April 10th at 6:30 p.m. also. And the regular county board meeting is on April 19th at 6:30 here. Is there any public participation this evening? Seeing none. Let's go on to the consent agenda. Items that want to take off the consent agenda, Mr. Goss.
Yes, Mr. Chairman, I request that we remove item C1. C1.
Okay. All right, that's the transportation. We'll move that item into we'll move that to item 14C1. So it'll be right before new business. Any other items that you wish to take off consent? Give a motion to approve consent, please. Moved by Mr. Esri. Second by Mr. Harper. Roll call, please.
Clifford. Yes. Cruz. Yes. Esri. Yes. Furtado. Yes. Goss.
Yes.
Harper. Yes. Hartke.
Yes.
King. Yes. Marsh.
Yes.
McGuire. Yes. Mitchell. Yes. Patterson. Yes. Petrie.
Yes.
Rosales.
Yes.
Storr. Yes. Summers. Yes. Tinsley.
Yes.
Anderson. Yes. Clemens. Yes. Weibel.
Yes, motion carries. Communications from county board members. I just want to point out that at your desk you have a letter from the Illinois Housing Development Authority on some new housing they're going to build in northern Champaign. Basically gives you a opportunity to comment on that, so you may do that. You also have the the quarterly report of the Champaign Economic Development Corporation on your desk too. Any other comments from the county board members? Okay, seeing none, let's move on to seek approval of the minutes of February 22nd, 2018 regular meeting and the March 13th, 2018 special meeting.
So moved.
Moved by Mr. Rosales, second by Ms. Petrie. Discussion of the minutes. Seeing none, all in favor?
Aye.
All opposed? Motion carries. Next up, we have the reentry program and annual reporting presentation.
Wow, that was fast. Hello, thank you for taking some time to hear from me tonight. I'm Bruce Barnard. I am a consultant with Rosecrance. I've been working on the reentry initiative since its inception, and I've also been involved in the Justice and Mental Health Collaboration Project. If you'll bear with me for just a minute, I would kind of like to digress a bit and put things in some perspective. I'm a bit of a fossil. I've been involved in these initiatives in this county for a long time. And we have just been asked to serve as what's known by stepping up as an innovator county. And that's quite an honor. It is tied into the Stepping Up initiative, which you passed a resolution some time ago for Champaign County to be a stepping up county in an effort to reduce the number of persons with mental illness who are incarcerated in our county jail. We've been actively involved in that, and actually prior to that, the Champaign County Mental Health Board had established a goal of reducing the number of persons with mental illness in the county jail and began to fund some case management, some linkage, some benefits case management to try and get individuals enrolled in benefits so that they could receive the treatment services that they need. That's been going on in this county for quite some time. The Justice and Mental Health Collaboration Project gave us an opportunity with federal funding to really take a closer look and to begin to coordinate with other counties around this overarching goal of reducing the number of persons with mental illness who are incarcerated in the jail. At the same time, you funded the reentry initiative, and the two are very closely related, and that's the reason that I really want to put that in perspective a little bit tonight. Those were two very important steps, and what the Mental Health Board has done in terms of providing funding for services at the jail, if we just look at the last 6 or 7 years, the number of bookings in the county jail is down significantly. The number of people who are receiving linkage to and receiving behavioral health services is up significantly. The municipalities and the county have increased their investment in crisis intervention team trained officers. And we have gone through a comprehensive planning process through the Justice and Mental Health Collaboration and have a set of priorities. Do we have more work to do? Yes. There are clearly needs that need to be addressed. There are things we need to do as a county. But I think it's worth realizing that when the Council of State Governments, the National Association of Counties, and the American Psychiatric Association contacts you and tells you that they consider you to be an innovator county, that you're doing something right. And I really want to take a moment and thank some of the people who have been involved in that. Alan Jones has really been actively involved in this process since the very beginning and has been very supportive. The state's attorney, Julia Reitz, has been involved and has been very supportive. Many of the initiatives that we have been able to do in this county have been very difficult in other counties that I've talked to because there's been resistance from the state's attorney or there's been resistance from the sheriff's office, from the jail administrator. Carrie Vogus has been extraordinarily supportive of what we've been trying to do at the jail. One person, Celeste Blodgett, who's been involved and is usually sitting right there to remind me of what I'm forgetting, unfortunately has submitted her resignation and has moved on to another professional opportunity. But we really owe her a debt of gratitude because she essentially did the lion's share of the work. She was the dedicated full-time employee that was working on reentry and the Justice and Mental Health Collaboration Project for this 3-year period. And it's been a privilege for me to work with her, and I think you've seen the outcomes of what she's been able to do, so that will be quite a loss. Rosecrans does have a transition plan, which is in effect now. Last Friday was her last day, so existing staff are picking up those responsibilities. There will be no lag in the services provided, but that will be a loss for us as going forward. So I apologize for digressing a bit, but I really wanted to kind of put that in perspective and, you know, reinforce the fact that Champaign County is actually doing a lot of things right, and we just need to continue to work in those areas that we're working in. In terms of the reentry services, I've typically put this slide up for you. This is the representatives on the Reentry Council. The Reentry Council has taken action to expand its role. In the past, it has been an advisory committee to the reentry program operated by Rosecrans and is really focused on people returning from incarceration through the Department of Corrections and people returning having completed a sentence at the county jail. The Reentry Council has recognized the need to look a little bit more globally at some of the other services that are happening at the jail and to serve more of as a coordinating council. That's one of their really important functions, to coordinate what community agencies are doing, the involvement of community advocates. We want to expand and include some people who were involved in JMHCP, such as NAMI, National Alliance on Mental Illness, and some additional county agencies or nonprofits that are working in the county and related issues. So going forward, the Reentry Council will have a bit of an expanded role. They have been meeting monthly for the 3-year period and have met 11 times so far this year. The primary function, as I see it, of the reentry services is our ability to reach out to every person who is released from incarceration in the Department of Corrections. We're able to do that because of the relationship that we have with the parole officers here in town and the parole office. They are active participants in the Reentry Council. To offer them services, to identify their needs, to link to other community agencies that are providing services that they need. And here's the numbers in terms of, we refer to that initial telephone call as a screening. And then out of that screening comes a request for additional contact, and we refer to that individual as being engaged. So you may hear me talking about the number of contacts, the number of screenings, and then the number of engaged. So the initial phone call is the contact. If they agree to move on to a screening, that's a screening. So 172 contacts, 79 screenings, and then 64 of those 79 were engaged in case management services over the course of the year. We've shifted a bit of our services to more of a contact and refer format. So in the future, they will receive more of the screening at the front end. So during the initial contact, and that will be done, and we've expanded our ability to refer. One of the things that we, and I'm probably getting out of order a little bit here, but one of the things that we have developed is a reentry resource guide, which is formatted for individuals, and it includes some worksheets that they can work through to identify their needs, and then links them with agencies that may provide services in the area that they're looking at. We've been tracking need and outcomes since the initiation of services. So this is based on self-identified information. So when we talk to someone, do you have a need for housing? Do you have a need for employment? Do you have a need for education? So you'll see the numbers that have identified that need. So housing, 35% of the people that participated in a screening identified a need for housing. Employment, education, medical services, benefits. Behavioral health really stands out in that, in terms of 85% identify a need for behavioral health services. That's where we have some of our most effective linkage, because the resources are available because of what I just talked about in terms of what the Mental Health Board is doing. So we have 60% successful outcomes with behavioral health, 77% successful outcomes with benefits. A successful outcome means that we have successfully linked that person to a service. So they are now receiving behavioral health services if they're listed as a successful outcome for behavioral health. We're able to acquire benefits through the program. 77%, that indicates that they completed an application for benefits, and we were able to get that processed. We have also continued to gather satisfaction data, 98% satisfaction, 92%, and indicated that they had experienced improvement in their situation since they engaged with services. And I'm rather proud of this, 100% would refer a friend in need of similar help. Satisfaction data isn't the same as positive outcome data, but it is indicative of engagement, and engagement is the key to the whole thing. Engagement is the key to successful substance abuse treatment, it's the key to successful mental health treatment, and it's the key to successful criminal justice case management. I've been doing this a long time, and if there's very few things that I thought 20 years ago that I still believe today, but that's one of them. That engagement is absolutely the key to the outcome. You're familiar with this. We calculated the baseline recidivism rate in Champaign County. Recidivism is defined as a new judgment within 3 years at 31.85%. The documented recidivism rate for Department of Corrections is about 48%. So in order for us to measure recidivism with this population that we have contacted, we place them into cohorts because of the 1 to 3 year. So what we're seeing right now is 41% recidivism rate with cohort 1, 26% with cohort 2, and 18% with cohort 3. If we do the comparison between where cohort 1 was at this point and cohort 3 is now, I would anticipate that at the end of the 3 years, cohort 3 is going to be significantly less than cohort 1 in terms of recidivism. The population of clients that we are seeing is primarily Department of Corrections clients. So when you compare that to the overall recidivism rate in Champaign County, you're comparing it to a lot of people who were in for a short period of time or have never been to Department of Corrections, served out their sentence in the county jail, and then were released. A Department of Corrections sentence is much more disruptive in terms of the length of time, what it does to your employment history, your employability, your family relationships. So you would expect that the recidivism rate among people who are sentenced to the Department of Corrections would be higher than the recidivism rate among people who serve their sentence at the county. So we're serving both in our program, but it is primarily probably in excess of 90% people who are receiving service are being released from Department of Corrections. just some of the accomplishments that we've had, and I've told you before, that the Reentry Council itself is a significant accomplishment. Just the coordination, the ability of agencies and leaders to come together. And Pius and Jim, thank you for coming to the meetings and being a part of that. A major thing that's happened recently is that Housing Authority of Champaign County has joined the Reentry Council. Those of you who have been here for a while have heard me talking about the need to get that linkage and to get the Housing Authority interested in housing supports for people who are being released from incarceration. Well, they're there. And actually, they are considering an application to receive some technical assistance from the Vera Institute in regards to Housing Authority programs to engage this population. So I'm absolutely delighted. That's something that has needed to happen for quite some time. And it's a very positive development for the county and for our clients. I talked about the resource guide. We have developed lists of housing providers and employers for referral. We've researched best practices. We continue to research best practices in terms of what other counties are doing that is effective at reducing recidivism and providing successful linkage. We've obtained some funding for local transportation and participated in the expungement and sealing summits. But again, I keep coming back to really just having parole at the table, having the Reentry Council actively talking about these issues, having an opportunity for agencies that are seeing this population to come together to discuss how we coordinate, what the issues are, has really been a significant development and has had many positive benefits that you can't really track with numbers. So as I look forward, I really want to see us begin to develop initiatives that more effectively address the needs of the reentry population based on a risk and needs assessment. And that's something that is also in the recommendations of the Justice and Mental Health Collaboration Project that we will probably be seeking some federal funding to attempt to put into place. That is a structured mechanism of identifying someone's risk of recidivism and what needs they have that could be addressed to reduce their risk of recidivism. Continue to coordinate reentry services with other criminal justice focused initiatives. For example, CIT. There's a crisis intervention team steering committee. The jurisdictions that are involved in law enforcement response to persons with mental illness, coordinating the activities of that steering committee and the Reentry Council would give us just one more opportunity to look for ways to coordinate more effectively and make better use of the resources that we have. And continue to evaluate recidivism data and improve and plan future reentry services. When you look at that recidivism data by cohort, and I don't have it here, but I thought I did. Yeah, I had more detail than that, though, in another one. But anyway, when you look at that by cohort, you see the effectiveness. As the program has gone on, it's become more effective, and that's because of better coordination. That's because of streamlining the intake process and developing that intake. So continuing that momentum is really important. So really, I tried to keep it brief for you because I know you have all heard most of this before. So I'll open it up to questions.
Any questions for Bruce? Comments? Mr. Storr.
Thank you. Could you go back to the cohort slide, please?
Sure. I think.
Over what period of time is this recidivism measured?
So like, for example, cohort 1 is the people that were contacted in the first year of the program. And we continue to monitor over the 3 years. So that 41% recidivism rate is everyone who's received a new judgment out of that cohort 1 who was initially contacted in year 1. So
About 3
it
years.
carries them forward for 3 years.
Okay. Thank you.
So cohort 1 is really the only one that has that 3-year look back.
Quick
essentially.
follow-up on that. Is that 41% as of today or as of,
That's as of today.
okay, very good. Ms. Furtado?
In the written report on the Illinois Criminal Justice Information Authority, what were the barriers to that you felt were the barriers to the application or to submitting a successful application?
I don't want to speak to that in great detail.
I think time was a big issue. We didn't have much time.
Time to respond, but also I know Alan Jones had some reservations about the ability from the sheriff's side to meet some of the requirements, but time
And I
to
think,
respond to the
didn't we have to have a sort of a council in place or something in order to apply for
Yes,
something
and
like that?
there was a requirement for some diversion programs that we were concerned that we might not qualify
Right,
based
so it was-
on where we're at with diversion.
It wasn't a straightforward
programs.
application. You had to have certain things in place first. Mr. Anderson?
Bruce, on our handout on page 6, it talks about the recidivism data, and it reflects, let's see, actually I'm mistaken, page 5. It talks about the ethnic background of the people who were contacted, screened, service plans, contact, refer, great. Why don't we see the race indications on those who recidivate? If you're contacting, or am I not reading this right?
No, we have it.
Okay, because that
it-
might give me some indication of what's being successful. I know what you're.
Sure, sure.
I mean, it looks like the population is what you're getting coming out of the jail, and it's fairly representative of what's
It's
there.
fairly representative
But
of
what
the
is actually being
population.
successful, and are there some programs that are, for some reason, not being successful with certain ethnic groups? I don't know why that would be, but if you told me, well, and that would be a matter of, do we continue to refer people to outlets that aren't successful for that
Right,
group?
right.
Whatever that group might be, I don't know, but why don't we see that?
Just because it's not there. But it is actually remarkably reflective of the percentages that you do see. The recidivism rate does not seem to be higher with any particular ethnic population, or it basically, I mean, it's kind of remarkable how closely it tracks the population in the institution to the community and then carries forward.
All things being equal,
but
I don't think we would expect that, but, sometimes
No, absolutely.
there are
absolutely.
barriers out there that are, just in society
And
itself.
that's something we would want to know, definitely.
But recidivism seems pretty much equal to the population that's
Yes.
taking advantage of these.
Yes.
Thank you.
Other questions? Ms. Petrie?
Hi, Bruce. Thanks
Hi.
again for coming. Could you roll back on your slides I have a number of questions and I need to reference is that to the beginning?
The very beginning?
Yeah, and then let's move forward. Okay. Keep moving. Okay, I want to get to the statistics of the number of people who come into the program, and it's diminishing. So can you get to that slide? Is that the next one?
This one?
There, yes.
Okay.
Where is the slide that shows how many initial
I
contacts.
think you're looking at this one. So there were 172.
Yeah, right, okay. And then,
Contacts.
and then-
79 of them agreed to complete a screening.
right, that's the one I want. Thank you very much. So this has been a pattern when you've been here before, that initial number is fairly large and then it diminishes as you go down. Has that pattern remained the same, or are you learning things over this 3-year period of time to reduce that loss of contact?
And that's one of the reasons. So basically what that means is, of the 172 people that we contacted and said, hey, welcome back to the community, we understand you completed a sentence, we have some services available. And what we've done in the past is say, we would like to schedule a screening to find out what your needs are and how we might be able to compare or refer you to appropriate services that meet those needs. The idea behind the contact and refer model is, rather than making that screening a second step, to essentially turn it into a telephone screening so that we could complete it right then during the initial contact. It's too early, in my opinion, to say how effective that it will be in comparison. I think it's also important to note that every one of those 172 receive the contact sheet for agencies with information about how to contact, agencies about education, agencies that are providing reentry services such as first followers, agencies that are providing behavioral health support. So they all get that. So the drop-off is just people, roughly half are at that point declining to go on to an additional screening.
Okay, so then, and I've asked this question of you before when you've presented these kind of statistics, is there any effort after X amount of time where they've dropped off to reconnect with them?
And, obviously one of the things that we tell them is, if you have any additional needs at any point, please contact us.
The onus is on them rather than
But
on
the
you.
onus is on them, and in part that is because, we really don't have any relationship with them. We're making that initial telephone contact. I don't want to harass someone who's really, frankly, not interested, and that's the reason. I mean, that's something we could look at, but that's the way I've always thought about it.
Okay, so when we look at the recidivism statistics that you had up on the slide, you've lost a lot of folks, about 50% out of there. So those recidivism statistics are reduced greatly because your numbers have been reduced from the original contact. Am I understanding this correctly?
Yes, I mean, the recidivism rate is calculated for, but we also calculate the county-wide, so they would all be in that. But yes, the recidivism rate is calculated based on people who have received the screening. That's correct.
Okay, so in those statistics on recidivism, you have no idea if there's been recidivism of the other 50% that you've lost contact with. Is that accurate?
We know it because we know who they are, and we have the
You check
publicly
records.
available information.
And then are those in the statistics of recidivism or not?
They're not showing, they're not in there. What I'm showing you here, they are not there. But we certainly have it.
You do. Okay, thank you.
Further questions? Mr. King?
Thank you. Thank you for coming and sharing. I really just had 3 questions. The first one is, could you explain a little bit more about what engagement means? Is there a specific time frame that entails, or is there how do you all define that, I guess?
So, in terms of the statistical measures, so engaged, basically, so we contact someone and we ask them if they will agree to participate in a screening. If at the end of that screening, we say, those needs that you've developed, we have some community resources that we think would help you meet those needs. We would like to help connect you to those resources. That is the engaged population. So that's the people who have agreed to develop a service plan and work to make that engagement.
So through that process, are you starting to see like particular types of service plan or specific things identified in service plans that you can say, oh, this is a trend, we're seeing more of this?
And that's basically what
you
that
got right there?
is.
Okay.
Yep. Yep.
Right. And then, so my next question would be about benefits. I guess, as I'm looking at your annual linkages, looks like benefits is the thing that, of course, rises to the top. Could you speak to what specific benefits people are sort of going after?
Sure.
More specifically?
So a lot of that is done and is done with a contractual arrangement with Champaign County Healthcare Consumers at the county jail. And we use Champaign County Healthcare Consumers to assist with benefit enrollment for Medicaid, for Medicare, if the person is eligible, for other services, perhaps such as food stamps or those types of basic assistance. But for the most part, it's medical benefits. Because as you see, behavioral health needs, and in order to receive behavioral health services, you really need to have healthcare benefits.
Got it. Okay, and then my last question was, it was more, since you changed to the refer and the contact and refer process, I know you mentioned, or in the report, Mrs. Nance is mentioned. Is she at all still involved with what you all are doing, I guess, when you all were doing?
I'm sorry, I missed you're talking about Celeste or?
Yes, you have her in the report here, Mrs. Nance on page 3, I guess. And you talk about being an asset to the reentry program.
Oh, yes, she is still involved. She's actually working out of the jail. And so she is doing more with the behavioral health population than with just the straight reentry population. But yes, she is still involved.
Okay, thank you.
Any more questions? Ms. Petrie?
A clarification question to your answer to Robert. And you said that the largest percentage of the individuals that you tend to service are Department of Corrections.
Yes.
But when you talked about the benefits and answered Robert's question, you
jail.
said they were being at the jails. So does that mean that the people from the Department of Corrections are not getting this service?
No, we contact the case manager at Champaign County Healthcare Consumers to help the population that's coming from Department of Corrections.
Okay, thank you for the clarification.
Mr. Patterson?
Could you go to the needs slide?
Sure.
So for the percentage in the successful outcomes column, now, like, let's take the top one, for example. So when it says 4 or 11%, now is that referring to 4 to 11% of the entire population, or
No.
only 4 to 11% of the?
Of the people with that identified need.
Okay. So try to do quick math. It seems like the housing column is probably the one that has the lowest percentage of successful outcomes. You talked about how you guys have recently started collaborating with the Housing Authority, and in the packet, it makes reference to new HUD guidelines concerning criminal background. Could you elaborate on that a little bit?
That's not my area of expertise, but HUD has issued some additional guidance to housing authorities in regards to exclusions of persons based on criminal background and criminal history. But one of what we have been advocating for with the Housing Authority is a pilot project that would identify a population that has significant housing needs, that is receiving case management services. And I believe that I have reason to believe that we will have that in place fairly soon. And those pilot projects can make exceptions to other housing authority guidelines if the person is participating in that program.
Okay. It also mentioned in here that you guys are collaborating with other criminal justice oriented type groups. What types of groups are those?
So First Followers is a member of the Reentry Council. There are other reentry providers, Jesus is the Way Ministries, for example, in Rantoul. And then TASK, which is, I can't tell you exactly what the acronym stands for, but they are involved in reentry and have case managers in the prisons and do some special treatment population work in the prison and work on reentry. TASK is a member of the Reentry Council. Joe Gordon from Probation is a member of the Reentry Council. So we've tried to bring together everyone who touches the population in some way, shape, or form.
And just one last question. You talked about how you guys are, have you already done research on linkage, things that are linked to recidivism, or is that more of a future?
No, I mean, that body of research is out there, and that's that risk needs assessment that I've talked about. I mean, we know from a data standpoint and from a research standpoint what the risk factors really are, you know, in terms of a history of antisocial behavior, drug addiction, you know, those we know what the risk factors are, but there is an evidence-based risk needs assessment that can be conducted that helps you to prioritize and address specifically the risk factors that that individual has. And the problem is that those instruments, I mean, administering the instruments requires training. Some of them you have to pay for. So we just need the infrastructure in place to actually do that. And from where I sit, would like to see us decide on one risk needs assessment for the county so that probation is using the same one that's being conducted at the jail, which is being conducted by the reentry program, so that we're all using the same risk needs assessment so that we can share data in that respect, and we're not quite there yet.
All right, thank you.
Mm-hmm. Any other questions for Bruce? Mr. McGuire.
Thank you for this report, and thank you for listing the accomplishments. I think it's really wonderful to see how the communities come together and all the many levels that you've discussed. And now that we've had 3 years to see some real strength in the program and to see it go forward, I'm sorry that Celeste wasn't able to continue. Obviously, you weren't able to thank yourself for the work that you've done, and I wanted to do that.
Thank you.
And hopefully we'll see this grow even stronger. And that's all I wanted to say. Thank you.
Thank you.
Anything else? Mr. King?
Sorry, this is just a...
That's fine.
What's BOP?
Bureau of Prisons, Federal Bureau of Prisons.
Okay.
Sorry about the acronym soup.
It looks like in 15, 16, that was the only year that those numbers were, are they?
Yeah.
Is it still?
Federal Bureau of Prisons has kind of its own service system and well-established reentry system, so
Okay.
those clients do not typically take advantage of, but that's what that is.
Okay, thank you.
All right, one last chance. Thank you, Bruce.
Thank you all. I appreciate it.
Okay, next up is item 12. Mr. King, would you make that motion, please?
Sure. Motion to approve notification to Rosecrans of the county board's decision to renew funding for the reentry program effective July 1, 2018 through June 30th, 2019. Said notification required to be provided at least 90 days prior to the termination of the current term. And this will allow the parties the opportunity to negotiate the financial terms for renewal.
Thank you. Second by Mr. Hartke. Discussion. Mr. Goss?
Yeah, will we be able to discuss financial terms with a vote, or will this be negotiated and just moved? I mean, will there be a time when we talk about the financial terms?
Well, certainly you'll come back to the board, yes.
Okay, that's
Absolutely.
all.
Oh,
That
yeah,
was my only
absolutely.
question.
Absolutely. Further discussion, Mr. Patterson?
Guess I'm a little confused on the motion as far as, so this is not like authorizing funding?
No, it just says we're going to negotiate.
Okay. All right, thanks.
Yeah, it's confusing, but it is what it is. Mr. Anybody else?
Yeah, just to make it clear, what happened is that the current contract requires that we let them know we are interested in renegotiating 90 days out from renewal. So that's what we're doing now. Now we negotiate, a new contract will come before the board with the details.
Thank you, Mr. Hartke. Further questions? All right. All in favor? Aye. All opposed? Motion carries. Okay, next up is the finance, Ms. Furtado.
I move, we're under Finance A1, I move the adoption of Resolution Number 2018-68, authorizing payment of claims. Do I have a second?
Second by
Mr.
Mr.
Rosales? Oh, sorry. Oh, that's, you get to do it
Second
now.
by Mr. Rosales. Discussion. Seeing none, all in favor?
Aye.
All opposed? Motion carries.
I move the adoption of Resolution Number 2018-69, authorizing purchases not following purchasing policy.
For a second, second by Mr. King. Discussion on this item. Mr. Storr has a question. No, you can bring it up. Don't be sorry.
Thank you. On page 43, nursing home, supplies, license, late fee, Visa card member service, $1,025. Could we have a little explanation of that, please?
We'll let the auditor speak on that. It's her list.
Yes, sir. These are items that actually were from 2017 or prior, but now we're in the 2018 year, so they will all start showing up as exceptions. You'll probably see more and more of them, and certainly with our nursing home, because several of those obligations are outstanding longer than the past year here. Yes, sir.
Do you know what the license was? Or I'm curious.
Let's see.
And also, do you have a breakdown of maybe what the late fee
That was part
charge?
of their Visa bill, sir. And what they probably did, they had to pay for a licensing and use the credit card to make a payment versus a regular check that we put in the mail. Sometimes some of the people that they pay their annual dues to require payment through electronic methods, and our only electronic method is through our credit card system and not via check. So that could also be part of that. I can look at it even further and give you an email on that if you like and give it specific details, but I'm pretty sure that's what it is. The late fee also for the credit card, because as you know, we are a bit cash strapped for that facility, and therefore the bills have not been paid on a timely fashion. That's why the late fee, sir.
If you would take the trouble, I'm just curious what we're paying for a late fee and how much it costs to do this extra step.
Right. You will probably see late fees on many of our obligations that we are paying for the nursing home, but I am happy to get you that information, and if it's okay, may I email you, sir? Thank you.
Thank you very much.
Why don't you go ahead and send it to the Tyler County Board?
Sure.
Further discussion? Seeing none, all in favor? All opposed? Motion carries.
I move the adoption of resolution number 2018-70, authorization for loan authority to the nursing home fund from the general corporate fund.
Is there a second? Second by Mr. Tinsley. Discussion. Mr. Anderson. Is there a second for the roll call? Okay, we have we will have a roll call. Okay, discussion on the motion. Mr. McGuire.
So this is an issue to support the payroll of the county board. Do we know at this time if we're going to make payroll and how much this might be hit? Or is it the next one?
I think payrolls, go ahead, Mr. Fardy.
Everybody look at it first. Sure, I got my, yeah, this-
Nursing homes payroll for this week is $243,525.88. Right now, based on the cash on hand, I show the nursing home at $131,810.06 for cash on hand. And so payroll is due in my office tomorrow morning, so I will be accessing this loan immediately. Depending on your further action later in this meeting about the nursing home AP, I'm anticipating that I will need to access $210,000 in order to cover payroll tomorrow, and the loan, the $94,000.
Ms. Petrie.
The amount that you just quoted for payment to the employees, is that more than we paid the last time? Can you kind of
Yes,
remind me?
it's about $20,000 higher than the last payroll.
Is there a reason for that?
You'd have to ask the nursing home. I don't get those type of details. I just get a number.
Okay.
So I don't want to give you bad information on that. That's definitely a management question.
Ms. Busey has a comment on that.
The overtime for this pay period was higher than normal and is probably a substantial portion of the difference between the mid-220s and the 240 that we're seeing for this pay period.
Okay, I appreciate that because basically the census has stayed the same, so I wondered why that jumped. Thank you.
Mr. Anderson.
Just so I'm clear, on our desk this evening, there was, under the goldenrod, back in the second page from the back is a email to our chair, Mr. Weibel, from Barbara Mann, that references this item, and the conclusion occurs in the last sentence, well, the last paragraph, basically saying this only requires a majority vote to pass, and that is correct?
That's correct. A majority of the people here.
Thank you.
Further discussion? All right, roll call.
Clifford? Cruz? Esri?
Yes.
Furtado?
Yes.
Goss?
Yes.
Harper?
No.
Hartke?
Yes.
King?
Yes.
Marsh?
Yes.
McGuire? Mitchell? Patterson?
Yes.
Petrie?
Yes.
Rosales?
Yes.
Storr?
Yes.
Summers? Tinsley?
Yes.
Anderson? Clemens? No. Weibel?
Yes. Motion passes 15-5. Oh, sorry. Is that right?
That's right. 15 to 5.
Right, 15-5. Okay, do we have anything on the addendum? That's under new business, though.
May I
Okay.
ask a question?
Ms. Petrie?
Did you intend to skip 8? I mean 13, sorry. I can't,
For highway. That's for the highway consent agenda item.
Oh, no, we haven't got there yet. That's after policy and personnel. I may put it in the wrong place, but that's where I put it, so we're stuck with it. We'll get to that.
okay, thank you for the clarification.
Okay, thank you, Ms. Furtado. Let's move on to policy personnel appointments. Mr. Rosales.
I move the adoption of resolution number 2018-71, amending the schedule of authorized position for the Champaign County State's Attorney.
Is there a second? Second by Mr. Anderson. Discussion on this item. See none, all in favor?
Aye.
All opposed? Motion carries.
That's all for policy and personnel appointments.
Thank you, Mr. Rosales. Let's move on to Highway and Transportation. Mr. Mitchell, on the item taken from the consent agenda.
Move to adoption resolution number 2018-62, resolution awarding a contract for the purchase of a new 2019 tandem axle truck by the Champaign County Highway Department. So moved.
Is there a second? Second by Mr. Summers. Discussion. Let's go with Mr. Goss.
Yeah, it's the reason I asked this to be pulled. I don't think at this point there's an urgency for this truck. I think we can make do. We purchased 4 new ones in the last 2 years. I think we ought to reserve this money back until we see how we get along further with the nursing home. I guess I would rather use this in a budget cut to facilitate further budget amendments than something else. So that's why I asked that this be pulled.
Discussion on that. I would point out that this money is restricted use. Mr. Harper.
I guess that was my question. I agree with Mr. Goss, but what fund was Mr. Blue, or is this a highway tax fund, motor fuel tax?
Motor
money?
fuel, that's correct. Oh, well,
This is probably the highway property tax fund. This is the
Okay.
highway operating budget, and those property taxes are restricted to be used only for highway operations.
further discussion. All in favor?
Aye.
All opposed? Let's have a show of hands. All those who favor? 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. I see 14 in favor. All those opposed? 1, 2, 3, 4, 5, 6. Okay, 14 to 6, it passes. Okay, let's move on to then new business, highway and transportation. I'd like to have a motion to suspend the rules because it did not go through committee. Moved by Mr. Ezra, second by Mr. King. All in favor?
Aye.
All opposed? Motion carries. Thank you. Mr. Mitchell.
Adoption of resolution numbered 2018-61, authorizing the approval of the capital grant amendment number 1 and the execution of any subsequent agreements for the state and federal mass transportation capital funds. So moved.
Second by Mr. Hartke. Discussion. We do have personnel from the RPC who want to talk about this. If you have questions. Mr. McGuire, you have a question?
This lists furniture. Does anybody know where it was purchased from?
I think we can get an answer from Christian or
kind of a
Rita
strange
or Rita. Apparently they're voting on Rita to come forward.
As long as it's not from the same place that Ben Carson got his.
We'll ask her other questions while we have her.
Good evening. At this time, we don't know. We just estimated the cost of the furniture, but we haven't decided from where we'll be buying
Okay,
the
good.
furniture.
Then I won't have to worry about recusing myself. Can you tell us more about what this project is about?
Excuse me?
Can you tell us more about what the project is about?
We received capital funding long time ago, but it was only $15,000. We spent the funding on buying some furniture for the offices when we started C-cards. But then back after we spent that money was frozen due to the impasse with the state funding. And then just last November, we were notified that we had in our account close to $130,000, about $130,000 that we had to spend immediately, otherwise we were going to lose the money. Then we have been working for a long time on trying to get intelligent transportation system software for the buses to make them more efficient in terms of scheduling rides and all that. And aside from spending the money on that software, installing that software in all the buses, we use the remaining portion of the funding to buy bike racks for all the buses, to install benches in Rantoul, to buy some furniture for the offices of C-cards.
So is that software to improve ridership, and made it easier so people can schedule their rides? Is that what has lowered that number of denials?
Exactly. That's the idea, that we can make better use of the staff in terms of scheduling all the rides and making the riders of the buses aware of when we are arriving, when we are leaving, notifying the riders about the next ride that they have to make the system more efficient in general.
Okay, great, thank you.
Any other questions? All right, thank you, Rita. All those in favor?
Aye.
All opposed? Motion carries. Thank you, Mr. Mitchell. Let's move on to finance. Ms. Furtado again.
New business.
New business. So first, number one, the adoption of resolution number 20181, authorizing an agreement for healthcare services at the Champaign County Juvenile Detention Center with Correct Care Solutions, LLC.
Is there a second? Second by Mr. Anderson. I want to point out the resolution in the handout has an incorrect date. Although the explanations for it's correct, it should be end in 2020, not 2018.
Oh.
Discussion of this item. Mr. Storr.
Thank you. Is Correct Care Solutions a local company, or where do they come from? And do they use local facilities, say at Carl or OSF?
Well, they're not part of Carl OSF, so I'm not sure where they're based out of. Do you know, Deb?
I believe they're based out of Nashville, Tennessee. This is a contract for the Juvenile Detention Center that follows the sheriff's contract for these same services, which is competitively sought. So this is a result of a competitive purchasing process.
Further discussion. Seeing none, all in favor?
Aye.
All opposed? Motion carries.
Next up, please go to your yellow packet and move to, and this is an updated version of the amendment, Budget Amendment 18-00011 and Resolution Number 201-82, which includes the reason to appropriate funds to pay nursing home structured settlement agreements due April 1st, 2 p.m.I., $26,792.36. Health Pro, $39,973.57. IDPH penalties, an amount of $5,876.11 and $6,250. And CMS, $4,415.92, and to pay consolidated $914.02, and Cisco $6,865.71 to ensure continuation of phone and food services, and to pay Visa $2,531.06, and Wex Bank $418.40, which is totals $94,038.
Is there a second? Second by Ms. Petrie. Discussion of this item. This will require 15 votes and a roll call. Ms. Petrie.
Clarification to our auditor, please. Mr. Storr questioned the Visa bill, and now we have more Visa. Maybe we could, when you send him that explanation or send the whole board that explanation on that first one, you might include it on the second one.
I can send a detailed report on this.
Great, thank you.
And just a little extra here, Wex Bank is their gas card, in case anybody was wondering about that. That is their gas card that they use for their transportation.
Yeah, I've got a few topics here I wanted to discuss regarding this and what's sure to be future budget amendments. In this case, what happens if this fails? What do you see as the procedural, what happens if this would happen to fail this evening?
Deb's prepared to answer for this, I guess. Go ahead.
Well, as much as possible. If this fails, I believe that the county could be taken to court because we've signed off on consent decrees and settlement agreements for the structured payments that are indicated here. If this fails, there could be an issue with continuing to have food delivered with the current vendor, and I'm not sure how likely it is that we would be able to find another food vendor on short notice. And the same is true with the communications, the phone service. Therapy services as well with Health Pro, but that's one of the structured payments where we have entered into an agreement, and they could now obviously take us to court.
Second question, I noticed that we brought this one forward with no appropriate budget cuts. I would like to see as vice chair in the future that we bring forth appropriate budget cuts every time there's a budget amendment. We can't just continue to take this from fund balance. So we're going to have to start to make significant cuts to the general fund every time we bring this forward. We did have, I talked with Ms. Ogden, and we did have a little bit of an overrun last year at the end of the year that was about 81,000, but we can't continue to dip into the fund balance here. So as these proceed to move forward, and we know anybody that thinks this is the last one, you're kidding yourselves. We'll have another one in April, I guarantee it. But I would like to see, as these are brought forward, that we have appropriate budget cuts as well.
That'd be something for the Finance Committee to work on, certainly. Ms. Busey?
Yeah, my only comment would be that if these are to be accompanied by appropriate budget cuts, this board is going to have to determine what it seeks to have cut from the general corporate fund budget, because these are expenses for the nursing home. I'm not sure what the definition of appropriate budget cut is. I believe the Finance Committee and the board are going to have to make determinations about what in the fiscal year 2018 general corporate fund budget is going to be cut. I couldn't bring a budget amendment to you next month for the nursing home and say, and at my own discretion or the discretion of staff, this is what we're going to cut. That's a decision that the board is going to have to make.
Thank you. And that's kind of what I'm getting at is I think this board is going to need to start to decide what priorities are, because there's going to need to be cuts. I didn't mean to direct that specifically to you, Deb, but I think that as a board, we're going to need to define what the budget cuts are going to be every time we get another one of these $100,000 budget amendments. And I guess kind of the final thing is, we're headed toward the financial disaster that I've been talking about for the better part of the year I've been on the board. And all you have to do is, we've laid out, I think some of you guys saw my budget projection that I laid out on the big sheet of paper. I haven't missed it yet. So we're headed down a path here. Our accounts receivable are climbing. Our accounts payable, you saw Mr. Chairman Weibel put out something that what wasn't paid this month. This thing is running away from itself And I mean, it's a snowball that we're not able to stop at this point. And so, you know, we've got to come to hard decisions here in the next, my opinion, in the next 30, 45 days at the very slowest. Because this is not an easy call, and it's not going to be an easy decision, but it's not getting better. Regardless of what's been told, it's not getting better. I think we're seeing that on a real regular basis now that we've actually taken over the more of a guidance of the AP. We're starting to see it in our face every couple of weeks what this is, and as soon as Treasurer Farney hits that loan tomorrow, every dollar they get in the next 2 weeks is going to go to pay back what they've borrowed up. So they're going to have the same cash flow crunch. So we need to be prepared. I'm just, as the Vice Chair of Finance, I'm just trying to prepare you that this is going to be a challenge. That's the extent of my comments. Thank you.
Thank you, Mr. Goss. Mr. McGuire?
I have the same concern for the acceleration in loans to the nursing home. It seems like we're paying almost payroll, every other payroll. Now we're paying almost every invoices they receive. I don't know how long we can continue to do this. I'm not sure who entered into these payment agreements. I know the forbearance agreements. I hope the nursing home isn't making a lot of other agreements that we're going to be responsible for. I guess I would suggest that we would have to look at layoffs at the county, or furloughs to start paying for some of these things, because we can't continue that. We're going to have to borrow from our own funds to pay those loans, which I think the treasurer is going to bring up, because we're not going to make it to the tax receipts this year, something we haven't had to do for the last couple of years. So we're in a pretty significant situation, and this can't continue. Thank you.
Further discussion, Mr. Esri.
Yes, I guess I had a question. On the revised, we have, and since it's been talked about somewhat before, we have the Visa and the West Bank, the gas card. What happens if we don't pay those? Just those two, if we amend it and
Well,
don't do those
what happens
specifically?
if you don't pay your own credit card? You get penalized. You may
Well,
lost.
we're already getting penalized.
Well, we will buy gas possibly, which is essential for the operation of the nursing home.
Yeah.
Mr. Marsh.
Thank you, Mr. Chair. Based on some of these comments, and I'm wondering, I'm directing this to you, is it maybe appropriate and responsible for us to start, or for you to assign a subcommittee to look at what cuts we maybe should recommend to the board, and even as well a contingency plan for closure or sale of the nursing home if we're not able to sell it? Thank you, sir.
I think the first item comes out of the finance should be doing that, and the second item, I think we can't. I think we have an RFP out. We have obviously one party interest. I think we have to wait to see what happens there. Mr. Harper.
I just want to kind of go along with what Mr. Goss and Mr. McGuire were saying here. The bleeding's got to stop. I've sat here and, yeah, there's some tough decisions coming up, but I listen to people come in, what they need. Mr. King has been very good about bringing different things to us in justice and social services. The housing needs, the one group spoke about. There's a lot of good things people are needing, and we don't have the ability to help. Not to say that the county can do it all on their own, but it needs to be a partnership, a collaborative effort with our communities in the county and work on these things. The state's attorney comes a couple of weeks ago. Their workload, and she needs another attorney. Well, you know, that's a mandated statutory requirement of this county, and hopefully she has the money, because we don't have the money. We have people from these Scotchwood subdivisions, and I just got a call yesterday for somebody down by Sydney with condemned, dilapidated properties. and we don't have the ability to help anybody. And this bleeding has to stop. Are there tough decisions? Yes, but this county cannot keep going this way. Thank you.
Further discussion? Mr. Mitchell?
Yeah, I mean, I just asked the question that, I don't know where the will is to sell the nursing home, but the question I guess we all need to answer is, what's Plan B? No one has brought Plan B to the table. We've had public discussion. No one has had a solution. So I guess for those that you know, wish to keep it, we do need to hear from you on what that solution is, because we are, I mean, each meeting is an ad hoc finance committee of the nursing home. So if anybody has some solutions that the whole board can grasp, I would really appreciate it. Thank you.
Additional comments? Mr. Goss, you have a perplexed look.
Yeah, I wanted to wait until everybody had a chance. I'd like to request a roll call.
We have to have a roll call. No problem. Okay, let's have a roll call, please.
Clifford? No. Cruz? Yes. Esri?
Yes.
Furtado? Yes. Goss?
Yes.
Harper?
No.
Hartke?
Yes.
King?
Yes.
Marsh?
No.
McGuire? Mitchell?
Yes.
Patterson?
Yes.
Petrie?
Yes.
Rosales?
Yes.
Storr?
Yes.
Summers?
Yes.
Tinsley?
Yes.
Anderson? Clemens?
No.
Weibel?
Yes, the motion passes 16-4. Thank you, Ms. Furtado. I think the only item we have left is the annual review of the closed session minutes. You've seen the memo from the State Attorney's Office. Is there a motion to keep, I'd like to see a motion to keep the minutes closed, please. Moved by Mr. Rosales, second by Mr. Hartke. Any discussion? See none, all in favor? All opposed? Motion carries. Obviously, there's no action on item B under other business. Seeing that there's no other business, we're adjourned.